Caesarean sections. Let's talk about it. Hi, I'm Dr. Nate, and I want you to have the information you need in pregnancy, so that you feel empowered to make the right decisions. And how you give birth is as important as it gets. To date, there are two ways that babies are born. Firstly is vaginally, and the second is abdominally, which is a caesarean birth. Caesarean section is one of the commonest abdominal operations performed. The numbers have risen significantly, with 31 out of 100 babies born via a caesarean section. Till recently, there was great pressure for us to limit the number of caesarean births. NHS England has now stopped using total caesarean section rates as part of performance management. Caesarean births are broadly divided into elective cases and emergency procedures. We grade these by how quickly they need to be performed. Category 1 means that the baby should be born within 30 minutes of requesting the procedure. You may hear this as a crash section and is the most time critical of the different categories of caesarean sections. Category 2 means that the baby should be born within 75 minutes of requesting the procedure. Category 3 is listed for when the baby should be born within 24 hours from when the request is made. These timeframes act as a guide, but in most circumstances we do our best to have the baby born as soon as possible. Lastly, all elective caesareans are classified as Category 4, and we typically arrange these between 39 to 40 weeks of the pregnancy. Though there will be reasons for us to advise for the birth to take place at an earlier gestation, or you may prefer for it to be scheduled at a later time. There may be a multitude of reasons for offering or requesting a caesarean birth. They can be divided into two groups, maternal concerns or fetal concerns, though at times there may be a mixture of indications. There are certain severe heart, breathing or neurological conditions which pose a grave risk of death or worsening of function to the mother due to the physical stress of the labour process. C-section is also considered for women who've had previous caesarean births, or people who've had previous severe perineal tears involving the muscles of the back passage and consequently have troubles controlling their bowel motions. There are also psychological concerns for which a caesarean birth is preferable. Tocophobia can occur to people who have no previous experience of childbirth or to someone who had a previous traumatic birth experience. There are helpful services for women with tocophobia to access during pregnancy. There may be acute conditions during childbirth which may necessitate immediate delivery via a caesarean. For instance, a cord prolapse, uterine rupture, or a placental abruption, all of which starves the baby of oxygen, risking long-term brain damage or death if not managed in a timely manner. Some of these conditions, such as placental abruption, can also risk mom's physical health. Other conditions to consider a caesarean during labour include fetal distress, which means the baby is struggling to maintain a sufficient amount of oxygen to supply the tissue, leading to potentially dangerous amount of acid building up if labour was to continue. Or the progress of labour has stalled despite efforts to assist with progress. Outside of labour, a C-section may be required if the baby isn't head down, for twins or triplets, a placenta that is slow-lying or has invaded through the muscle of the womb. Or there may be genetic or congenital issues which means labour will be too dangerous for the baby, for instance, severe haemophilia in a male baby. And of course you may wish to proceed with a caesarean birth without a clinical reason. There are many reasons why a planned caesarean birth may be a better choice for you. Firstly, because the date of birth is scheduled, you can make appropriate arrangements before the big day, such as childcare plans. You may avoid severe perineal or vaginal tears, as well as regular labour contractions. Compared to vaginal birth, there is also a reduced chance of urinary incontinence, and there is reduced chance of fecal incontinence compared to assisted vaginal births. With the C-section, perineal or abdominal pain seems to be less during and 3 days after birth. It's also important to understand what are the potential negative outcomes with a planned caesarean section. Compared to a planned vaginal birth, there is a high chance of needing a hysterectomy during labour. The length of stay is 1 to 2 days longer with a scheduled caesarean birth. There is also a high chance of death for women who undergo a planned caesarean birth. There is also risks to baby compared to a vaginal birth. However, the relative risk is very small in some instances. There is a high chance of neonatal mortality, and there is a slightly higher chance that a child may develop asthma or childhood obesity at later life. Having a caesarean section will also have implications for future pregnancies. Scar tissues may form inside of the abdomen, which will complicate abdominal procedures, including subsequent caesarean births. There is a significantly high chance of uterine rupture, and of the placenta covering the entrance to the womb, which is called placenta previa, as well as placenta accreta spectrum, which ranges in severity, from a placenta that is incredibly stuck to the lining of the womb, to one that invades into the muscle layer of the womb, or even to the surrounding tissues like the bladder, which is a very dangerous condition. and the risk of these conditions goes up with the number of caesarean births a woman has. Women who have a caesarean section are also at risk of developing a caesarean niche, which is a defect at the scar on the womb. This can lead to erratic and prolonged periods, continuous brown discharge, chronic pelvic pain, subfertility, and spotting after the menopause, which may require surgical intervention. There are also specific risks with a caesarean section which I've included in the description below. Therefore, it's important to appreciate what are your main concerns when it comes to how you wish to give birth in light of the important risks and benefits of both vaginal and caesarean births. And if you have any question, always speak with your midwife or obstetrician. So, you're now in hospital with your planned C-section. What should you be expecting? You will first meet the team members looking after you and your baby. This includes the anaesthetist, the midwife, and the surgeon. They'll go through their roles, the consent form, and answer any questions you may have. You can have a light meal 6 hours before the procedure, and clear fluids up to 2 hours before the start of your operation. Some hospitals will also provide you with a high caloric drink to consume 2 hours prior to the caesarean to help reduce thirst and hunger during the procedure. You may be given antacids prior to surgery in the event that you may need to be asleep during the procedure, which will help make the process safer. In most caesarean births, the anaesthetist will provide a regional anesthetic block, which can be a spinal, an epidural, or a combination of both, in order for us to proceed with surgery. This is safer for both mum and baby when compared to a general anesthetic. It takes away the pain and cold sensations, however you will still feel pressure, pulling and tugging during the operation. Rarely, a general anesthetic may be required. For example, if there is a spine problem, or if we encounter a complication during the procedure which necessitates a longer than expected time in theatre, risking the regional anesthetic wearing off. Perhaps we're under time pressure, and a general anesthetic is the faster way for us to deliver the baby in good condition. Once the anesthetic has been administered, we will do several checks before we start with the first incision. We will insert a urinary catheter to empty the bladder. We may clean the vagina, especially if the membranes have ruptured. And we will listen to baby's heartbeat after the spinal anesthetic has been given. We then give medications, including antibiotics to help reduce the chance of infections post-operation, anti-sickness drugs, drugs to help maintain good blood pressure, and fluids intravenously. The temperature of the operating theatre is checked constantly to prevent you from developing hypothermia, though you may still shiver because of the anesthetic block, as well as adrenaline coursing through your circulation. But we will check your temperature regularly just to make sure. You may notice us complete several checklists before the operation and afterwards, and this is to ensure that everyone knows what needs to be done when and what problems we may encounter. We clean the abdomen with either alcohol solution or iodine, and then we place a drape over it so you won't be able to see the more gory part of the procedure. Once the baby is born, we can lower the drapes with your permission, and we will delay clamping the cord unless there is urgent need to provide immediate care to the baby. In some units, the cord can be cut by the birth partner, and the baby can be placed on mum's chest immediately, but check with your hospital providers to see what can be done in the operating theatre. Skin to skin with the mother is our default, unless you prefer otherwise. Once the baby is born, we will give you a medication to help deliver the placenta and to minimize blood loss. The remainder of the procedure involves removal of the placenta, ensuring the bleeding is under control, and closure of the layers of the womb, abdominal wall, and skin. If uncomplicated, the procedure will be completed in less than an hour, after which we will transfer you and your baby out of theatre for further monitoring. We encourage early reintroduction of meals, aiding you in getting out of bed as soon as possible, and removal of catheter. We can also support you with breastfeeding if that is how you wish to feed baby. I hope what we've covered in this video helps you with your decisions. If you're still unsure, speak to your healthcare team. Be sure to give this video a like, and leave a comment below if you want more information about care after a caesarean operation. Share it with friends and family, and subscribe to the channel. I'll see you next time.